Breaking tonight, serious new worries about President Obama's plan to save more than 5 million Americans from having no insurance thanks to his signature health care law. Plus, a new warning about how tens of millions of Americans will likely lose their insurance at work in the coming months. Welcome to the Kelly File, everyone. I'm Megyn Kelly. A series of developing stories now concerning the troubled Obamacare rollout. First, involving a White House meeting with insurance insiders that took place a little earlier tonight. The insurance folks came out of that meeting warning about higher premiums and about potential gaps in coverage for the Americans whose policies have been canceled. People who had their insurance and liked it and got canceled thanks to the law and now appear to be in no man's land. And the second story concerns a new report predicting a second wave of someplace between 50 to 100 million insurance cancellations in the coming months. This involves business, corporation, group health insurance, and that's a much, much larger market. We've been telling you about it. We have an update on it tonight. Mark Thiessen is a fellow at the American Enterprise Institute and a former speechwriter for President George W. Bush. Mark, let's take those in reverse order.
Sure.
First, people hear of 50 to 100 million insurance policies canceled, but you and I have been talking about this and the evidence for this case that this whole story about how it's just people on the individual market who need to worry and no one on the group market, the employer-based market, excuse me, needs to worry, it's unraveling.
Absolutely. No, this is an Obamacare time bomb that's about to go off. And if you want to know why the Democrats are panicking, look at the anger that's come out over the last few weeks, over 5 million people losing their plans on the individual market, and imagine the mass outrage that would happen if 50 to 100 million people lost it in the employer-based market. This is a huge, huge issue. And what's happened is small businesses found a loophole in Obamacare that allowed them, if they renewed early, they could avoid all the mandates that are pushing people out of the individual market for a year. So what that means is that they're going to get their cancellations in October 2014, which is 1 month before the midterm elections. So there's this time bomb going off of all these employer-based plans that are going to get canceled, just like the individual market plans now, right before the elections and the midterm elections in 2014.
The thing is, we led this our broadcast this week with Andy McCarthy, former federal prosecutor, who found a DOJ brief pending alive at issue right now in a court of law in which Barack Obama's Department of Justice admitted that, Mark. They admitted that the majority of group health insurance plans are expected to be canceled. They said it by the end of 2013. Now it's going to be the end of 2014 because of the one-year extension the president gave them on the mandate. But they've admitted it in writing. Why is no one talking about this? If you level the group health insurance market, you are talking about, as we say, up to 100 million Americans, people sitting back there right now with their employer-based health care thinking, well, I feel bad for the folks on the individual market, but it's not me.
Well, because the left has been accusing the right of saying this really isn't a takeover of 1/6 of the economy, but it is. This has been all along. The plan has been to get all of these people out of individual private health insurance and into government health insurance because the ultimate goal is single payer. So this is all small baby steps towards the ultimate goal of the progressive movement, which is a single payer.
Well,
and so they're using this as a stepping stone to what their ultimate goal is, which is to get the private insurance market out of it, to kill it.
All right. In the meantime, let's talk about the latest news on the president's fix, because he met with the insurance companies today, and they did not emerge happy from the sound of it, Mark. Warning of higher premiums. Hello?
Yep.
This is one of the main purposes of Obamacare, was it not? To lower costs, not to increase people's premiums. But it's happening. And now the people who are not, the 5 million people in no man's land, they're in purgatory, wandering around asking, insurance here. Several of the states at issue here have said, we're not going along with the president's fix.
Yeah, and most of them are blue states, which is very interesting, because you've got these blue state commissioners in places like New York and Vermont and Minnesota and some of these other states that are rejecting the fix because they need those people who are mostly young and healthy to go into the exchanges so the exchanges work. They know the exchanges won't work without it. So it's actually Republicans, the red states, are going along with the fix and trying to make it work as best they can. It's the blue states that are turning it down, Obama's supposed allies.
But you're also seeing that the states that are going along with it and trying to allow the insurance companies to offer these plans back if the insurance companies so choose. I mean, because you got to get past the states saying okay, and then you got to get the insurance companies to say okay. And then they have to comply with all the regulations that Barack Obama just put on them in terms of, and send a letter and compare the two plans and do it all immediately, blah, blah. So the policies that they may offer the canceled people have higher premiums.
Yeah, because they've been planning for 3 years to cancel these plans and push them into the exchanges. So now, 6 weeks before the end of the year, the president says, oh, you can continue offering them. That's going to cost a lot of money. So they have to pass that on somehow so the premiums go up. And so what's going to happen is, on January 1, either they're not going to be able to keep the canceled plans, or the premiums will go up so high that people can't afford them, and so these people are going to be without insurance. And then on top of that, next year you've got the additional time bomb of the employer-based plans. But even if Obama's plan worked, let's say it worked and some of these people could keep their plans, they only keep them until October 2014, when they lose them next year, a month before the election. So there is no easy, you can't screw up 1/6 of the economy and wave a magic wand and fix it. That's the problem they're learning over there in the White House today.
Mark Thiessen, thank you.
Thanks, Megan.
Also developing tonight, a Republican congressman introduced legislation